I'm not doubting you, doctor. I just need to understand so that I can make the correct decision. You can think about getting second opinion if you feel rushed, no options were discussed, gut feeling matters. If you are considering any kind of surgery, you need to listen to these 7 questions to protect yourself. These simple questions are the most useful information you can get for surgery. I'm Dr. Uttam Shiralkar. I have been a surgeon. I'm going to tell you something that no other surgeon will say, which is we train surgeons' hands but not minds. And I'm trying to fix that. In this video, you will see how patients can do that. You don't need a medical degree to protect yourself as a patient. You just need right questions. I will give you the exact words to say, the red flags to watch for, and when to walk away. Why these questions matter? Most patients, when advised surgery, just accept the advice, leave everything to the surgeon, and hope for the best. That is understandable. It's human. But it is not safe and not the smart thing to do in this day and age. Because your surgeon makes decision based on what they think matters. But it may not be the best thing for you. These 7 questions helps to clarify surgeon's thinking. So let's start. First question. What exactly is my diagnosis? You can ask, Doctor, can you please explain what my diagnosis is in simple words for me to understand? When you are told the diagnosis, you need to ask, can I repeat it back so you can check if I understood it correctly? This is very important. It is to make sure you understood it well, to repeat it. If you can't repeat it and explain it to someone like your family member, you did not understand it. Second question would be, what are my realistic choices? The question should be phrased like this, that what are my options? Surgery, medicines, lifestyle changes, or simply wait and see? If the only thing you hear from surgeon is surgery, that is a red flag for you. What happens if we wait? Even if you are told that surgery is the only choice you have, you still need to ask, if I don't get operated now, what happens in, say, 6 months or 1 year? Because sometimes waiting is completely safe, although sometimes it is dangerous, but you still deserve to know if you have that choice. What are the main risks? Say, with my age and health, what complications are most likely to happen? And then add, if that happens, how would it affect my day-to-day life? In the answer, don't accept just numbers or statistics. Ask for real outcomes that will happen in your day-to-day life. Then the next question is, what will you do to reduce those risks? What steps do you and your team will take to avoid that problem and to make surgery safer? A good surgeon will talk about checks, precautions, monitoring, and backup plans. Sixth question is, how many of these operations have you done in last 1 year? Remember, by asking this question, you are not being rude. You are being smart. And the last question is, if this were your family, what would you do? If this were your parent, child, or spouse, would you do this surgery now or choose something different? Now, for this question, more than what the surgeon says, watch their body language. That pause or hesitation tells you everything. Now, if you're worried that if you ask these questions, the surgeon will get annoyed or you may appear rude, you can phrase the questions little differently. You can say, I'm not doubting you, doctor. I just need to understand so that I can make the correct decision. From my personal experience, I can tell you that good surgeons won't get annoyed, won't dismiss, or won't ignore your questions. If a surgeon do that, you need to be careful. You can think about getting second opinion if you feel rushed, no options were discussed, your risks or apprehensions were dismissed, or your questions get ignored. Most importantly, if your gut feels uneasy. That gut feeling matters. And another thing to do before you go to the hospital, write your symptoms. Specify the exact location where the problem is, especially which side they are, right or left. List your medication. Note past surgeries. Take one patient with you to the hospital and don't forget to take these questions. Preparation protects you. And for surgeons, those who are watching these videos, ask yourself, would I answer these questions calmly, honestly, and appropriately? Remember, patients who ask these questions are not difficult patients. Consider them as partners in the safety of the surgery. Now you have a toolkit. 7 questions that makes surgery safer. You don't need to remember everything. Just remember, you are allowed to ask. If you found this video helpful, please subscribe the channel and tell me in your comments, have you ever felt rushed before surgery? Your surgery might save someone else. Thanks for watching.